session and are going to make today's session available for folks. So if you have anyone else in your organization or partner organizations that you want to send this to, we'll have that available up on our website as well, probably by the end of the week. All right, so here we go. All right, so the purpose of the Innovation Lab grant program really began in 2017. For those of you who are new to partnering with HealthSpark, we have taken a very community-driven approach to our philanthropy. And in 2017, we actually hosted a number of community conversations with nonprofit partners and government and other philanthropies, as well as activists and different grassroots organizations to design the foundation's strategic plan for the next 10 years and what our investment should be. And so from those conversations, what we found was one, we designed the Safety Net Resiliency Initiative, which has a mission to create a more equitable, inclusive, accessible safety net system. But two, it also created 6 different strategies for us to invest in as a foundation. One of those strategies was the Innovation Lab. And kind of the conversation that generated this idea and this grant program was that there really is no funding available in Montgomery County for nonprofits to test out new ideas, to work together on collaborative partnerships that may be able to generate more effective service delivery programs. Really, there was no research and development funding. And so we created the Innovation Lab to provide a space for that. What we also heard from partners is that we know that we can't create a more equitable safety net system one single organization at a time, but rather that these projects need to be led by partnerships of organizations or collaboratives of organizations. And so the Innovation Lab has at its core that every project needs to be carried out by at least 2 organizations, if not more. We also have ongoing learning as a part of the Innovation Lab. At HealthSpark, we don't like to hold tight onto grant reports or things like that, but actually we have a learning collaborative for all of our grantee partners through the Innovation Lab to help nonprofits learn from each other and identify challenges and successes and share those with each other throughout the process. So as I mentioned, the purpose of the Innovation Lab is to support systems change projects that will improve how the safety net system functions overall. And it is to advance the 6 goals of the Safety Net Resiliency Initiative, which we'll talk about now. So our vision here, we envision a resilient and financially sustainable safety net that allows anyone in Montgomery County access to high quality, coordinated, equitable, and culturally appropriate services, no matter who they are, what they need, or where they live. We believe that a strong safety net benefits everyone. Montgomery County safety net will thrive through a shared commitment to nourish and sustain it. And our safety net will be connected, respected, person-centered, equitable, and impactful. And I just want to reiterate that these are not HealthSpark's words. This language in particular was crafted in 2017, as I mentioned, by community partners, but also updated last year in the midst of the pandemic, as well as during the racial reckoning that our country has been going through at a more pronounced way. And so you'll see throughout our revised Safety Net Resiliency Initiative framework that we're really calling out lessons learned throughout the pandemic, as well as things like justice and equity and advancing racial equality for all people. The goals that we have in the Resiliency Initiative, to which all Innovation Lab projects must align with at least one, are the 6 listed here. So the first, building the safety net system's capacity to advance racial and social justice. The second, putting an end to chronic underfunding and cutting the red tape of the safety net system, both for people trying to access it as well as for providers. 3, sustaining technology advances that have been piloted and put into place as a result of the pandemic over the last year, and supporting equitable access to technology. Supporting the emotional well-being of safety net staff and community members, which I think is even more pronounced now than it was a year and a half ago when we originally put this together. 5th, strengthening the operational practices of safety net providers. And finally, building a more vibrant, active, and inclusive community. So how to do all that. So overall, Innovation Lab grant projects are funded up to $30,000. We intend these to be short term. And we'll talk about why that is, but because of our grant cycle, we look at projects for this round starting on or after January 1st, 2022. Folks often ask, how often do you run this grant program? And the answer is usually about twice a year. So we will likely have another round in the spring for projects that would start around July 1 of 2022. And finally, as I mentioned before, all applicants must apply with at least one partner organization. And we highly recommend that you reach out soon to potential partners rather than towards the end of the application so that you can jointly develop the project proposal and the application together. So we typically fund categorize projects as kind of falling into two large buckets here. So for systems change, what we're looking at first is proof of concept projects, which we describe as research, planning, and coalition building to rethink how services are delivered or to plan new models. So here the idea is that maybe over the last year and a half, you have recognized that services aren't being delivered as efficiently as they should be, or maybe you're not being as accessible to certain populations as you could be, or maybe there are disparate outcomes that are being reached by different populations across the county related to a certain service. And you want to bring folks together to think through how to address that problem and to jointly plan for a way to address that issue. So that would be a proof of concept project. The second large bucket of project ideas usually fall under pilots, which is that you already have identified a problem and a potential solution and are now looking to test that project. So here you may have developed a solution because you've already been engaging in some kind of facilitation or planning work before now, either through a prior Innovation Lab grant or through some other process. Or maybe there's a program template that another community has been using and you want to apply it here locally in Montgomery County. Those may be opportunities to actually run a pilot program. The kinds of project activities that folks usually undertake are listed here, but this is not an exhaustive list. And really, we look to you to tell us what is most necessary to get your project off the ground. So really, we're looking at outlining steps or procedures for implementing your systems change idea, building trust with partners, which we have heard from grantees is absolutely critical and takes much longer than folks think is necessary oftentimes. Articulating specific roles for each partner organization. So oftentimes when new organizations are working together, or even if you have a good existing relationship with another partner organization, it just takes some time to figure out who's going to do what, especially as you're thinking about maybe innovating some kind of service. And so you can spend time figuring that out. Research, whether that's local research or like a national scan, is all applicable. We really hope to see that you're engaging the intended beneficiaries of your service in the program planning and the design, as well as meaningful decision-making points along the way. And any work that needs to be done to meaningfully engage them in the process or prepare them to engage in the process is, of course, all applicable as well. You may need to identify training needs or infrastructure needs, especially if you're piloting or using new technology as part of your systems change initiative. Obviously, long-term costs and the financial impact is important to assess. And so we really hope that you're also thinking through kind of what funding is going to be supporting this. How can efficiencies be made? Are you bringing in a new service and losing another? Kind of how are you thinking about the financial impact long-term? And then finally, creating a business plan or a project implementation plan with timelines and milestones needed for a successful implementation. All right, just two important considerations that we want to call out in particular. These are things that we look for as we're going through project applications. Again, these are things that we have heard from our community are important to this kind of work. and also values that HealthSpark has as a foundation as a whole. So the first is around meaningful consumer and beneficiary engagement and appropriate compensation. So as I mentioned, in the human services sector, our intended beneficiaries or consumers or residents should have a say in how programs and services are designed and delivered. And so what we want to see is that your project is taking that into account and really thinking about how do we engage the intended beneficiaries of this service into our planning work, into our design work, in meaningful decision-making points along the way. This is more than just, oh, we're going to do a survey or we're going to get some feedback. This is really around engaging folks in a meaningful way and providing a meaningful opportunity to have a seat at the table. We believe that that's truly the only way to create a more equitable system. And so it's really foundational to our approach here. As well, we want to make sure that folks are compensated appropriately for their time. Just as professionals are paid to show up to meetings, we want to make sure that these folks are also paid appropriately. And so, of course, you are allowed to pay for consumer engagement and anything related to this out of grant funds. The second is that we want to see that the research and planning directly addresses disparities in access or outcomes by race, ethnicity, gender, sexual orientation, ability, or national origin, which is inclusive of both language and cultural competence. Here, what we look to see is, one, do you have an understanding of how disparities in access or outcomes are showing up across different demographics, and how is your project intending to address that? And two, how are you engaging people with lived expertise in that issue in the project? And ideally, project leads actually have the lived expertise themselves or are composed of organizations that have this expertise. What we have seen before, again, through the partnerships, is that maybe one organization does not have expertise in this area and they're partnering with another organization that does. And we'll talk through a couple examples of projects where you can see this come into play. So I just want to call those out because we do review that carefully as part of our project application review. As far as eligible costs for your budget support, so really anything related to planning and design work. So this could include paying for research, whether that's research your organization is doing, or if you're paying a consultant or university to conduct that research for you. Anything related to provider convenings, project planning, of course, your staff time. We want you to pay yourselves. We want you to pay your partners for their time. As I mentioned, consumer participation statements, any other community engagement expenses that you may have, as well as operating costs that directly support the project, such as your agency administrative costs and overhead. And we do not have a cap on an overhead rate. So that's up to you to tell us what your calculated overhead rate is. All right. So I want to take a minute just to talk about a couple sample projects to give you an idea. We do have a full listing of all of our funded grant projects on our website under our grants awarded page, so you can see more examples here. These are just a couple from the latest round that I wanted to call out. The first is CICATE, which is partnering with Core Americas Global around a Norristown Latinx community health census. So here, CICATE uses a participatory research model where they engage residents of their community to help design, in this case, a health census around health access needs by the Latinx community in Norristown. They have already tested that survey and are now looking to implement the survey, go door to door and have residents complete that survey. Again, kind of calling out, this is very much consumer-led, consumer-driven by an underserved population trying to access health services. A second example of a project here is the Deaf Hearing Communication Center is working with the Women's Center of Montgomery County around an accommodation investigation project. This is most recently, this was the implementation of a project that we had helped. I guess I should say, so we funded this project twice now. The first was for research around how to conduct the survey into access to human services by persons who are deaf or hard of hearing. And then again, most recently, we funded the project to actually conduct the survey. So in the first iteration, they had a sample survey that they sent out, and they learned a lot about how accessible that survey actually was and got some good data. Then they refined the survey and now have actually been able to implement that survey with the residents. But here before, what I wanted to call out was, I mentioned that not every organization may have expertise within the organization and their leadership around issues of access and inclusion. And so here, Deaf Hearing Communication Center obviously has a lot more expertise around serving the deaf and hard of hearing population than Women's Center of Montgomery County did originally. And so they're partnering together so that both organizations can benefit from the perspective that the other brings. And then finally, we have National Network for Youth and Your Way Home, which is conducting a landscape scan to determine readiness for a youth-led community collaborative. The idea here is that there are multiple youth-led advisory boards across the county that are advising on different systems. But for youth who are experiencing homelessness or involved in child welfare or other issues, or have mental and behavioral health issues, they kind of experience all of those systems in their life as a whole. So they don't kind of separate those things out. And so the idea here is it would be more helpful for youth receiving services through our safety net system if they could go one place and kind of look at all of these and provide advice on all of these different systems from one spot and in a more holistic and integrated way. So National Network for Youth is leading some work around actually conducting a readiness scan to see, are the systems ready to actually work together and what work needs to be done. They have already built up a youth collaborative that is helping to design and lead this process. And so I want to call that out because this is a national organization, but they have been working locally in Montgomery County for some time now and have already developed partnerships and relationships, particularly with youth who live here, to help drive forward the project. Alrighty, so turning to the application, we accept all of our grant applications online through Foundin, which is our grant portal. You can link to that through our website. Every organization creates a profile in Foundin that is connected to your organization's EIN number or EIN. So if you're new to your organization or kind of taking over grant making, your organization may have a profile already created, but you don't have the login. That's fine. You can email me or Claire. Actually, email Claire. We can help you get set up and reset your password and get you logged in. The system should not let you create a separate profile for your organization, and it's just silly to do that because the information may already be in there. So if you're not sure, just give us a shout and we can help you get set up. Otherwise, if you're new to applying to HealthSpark, you will need to create a profile for your organization. The application questions are listed in there for you. As I mentioned, we do have a list of all the application questions up on our website, so you can see what those are. You are able to submit your own budget form, use your own budget document, or you can download the one that we have on Foundit if you prefer. I want to make a note that we do kind of based on some work that we have been doing as a foundation to make the application process easier. We have set all the character limits to the max amount allowable per question. And we've done that because sometimes we know that you're copying and pasting information from another application or for program materials that you already have created. And we don't want to make it harder for you and have to like cut back on stuff because of a character limit. So we just want to make clear, we're not expecting anyone to actually use the entire character limit. We're just making that available in case it's easier for you to submit that way. And as I mentioned, the RFP and all of the other documents are available on our website via the link here. Claire, is there anything else that you want to add here just around the application itself or use the Foundin or anything like that?
No, just to follow up with what you said is that internally we've been working to try to ease the burden of application process. So we did add a question at the end of the application asking for the applicant to give us any feedback that they would like us to know from their experience of completing the application. And this time around, we're also asking you to give us an estimate as to how long it took you to complete the application. So if you're doing it in different times of the week or whatever, just, make a little note of how much time you spent on Tuesday, add in Thursdays, that kind of a thing. We want to know what we're asking you to do, how much of your time we're asking of you.
And Claire, are those submissions anonymous or are they linked to the application?
They are linked to the application.
Okay, so I just want to make clear, we would not ever make any funding decisions around feedback that we received there. And that, we take this wholeheartedly. I think we talked a little bit earlier about the purpose of learning and how important that is to our foundation. We really take that to heart here. And so we really hope to understand the burden of the application process and how we can make it easier to the extent that we can. So please feel free to put in your comments there, and they have no impact on your funding ability. All right, so as I mentioned before, we do encourage you to call us before you start applying or before you put pen to paper here, or fingers to typewriter, computer keyboard, just because we recognize that this is a bit of a different kind of a grant program. And so we like to have a conversation with folks just to help you put together the most successful project application and project design possible. We've learned a lot in our 5 rounds of doing this so far. And so we encourage you to do that and welcome that. I've listed my email here. And Claire, maybe if you could put your email in the chat for folks who have questions about Foundant. I apologize for not putting that up here. And the apps are due by 5 p.m. on November 1st. Yeah. All right, so I will take us off here. And if anyone has any questions, we'd be happy to answer those questions now. You can either take yourself off mute or put those in the chat. All righty. Well, as I said, we're here, so please give us a call, follow up. We'd love to hear from you, and we hope to, see your application. Look forward to reading them when they come in. Thanks everyone for joining us today, and have a great day.